Christmas is coming, and so is Omicron. The COVID variant was first reported by South Africa in November, and it's already spread to dozens of countries. The WHO has this message.
Omicron's very emergence is another reminder that although many of us might think we're done with COVID-19, it's not done with us.
To put it mildly, this is not where we'd hoped we'd be.
I feel like it's 2020 all over again in a way. You know, we're back where we were.
I want to consider where we were with COVID and where we are, and look at what we've learnt about this virus in 2021. Back in January, wealthier nations had only just started their vaccine rollouts. This was Israel. The pandemic death toll had passed 2 million, and the number of cases reached 100 million. In the UK, the infection rate was rising, as was pressure on hospitals. And amid all of this, the WHO had a message of defiant hope. This was in February.
I don't want to ask people to hide under their desks or duvets in fear. Actually, I want people to be connecting with each other and saying, you know, this is a virus that's particularly nasty, but it is within our power to be able to resist it.
Almost 12 months on, have we shown we can resist it? To answer that, we need to look at how this pandemic and our understanding of it have evolved this year. Certainly on one thing, there's been no change. We were told the vaccines worked, and they do. In the UK, as vaccinations increased, the number of hospitalisations dropped dramatically. The number of deaths dropped dramatically across the year too. And by the summer, we could also assess how the vaccines were impacting infections.
What we know with the vaccines is that they are actually remarkably effective at preventing hospitalisations and deaths. They are less effective at preventing infection.
The Delta variant had shown vaccines would not contain the spread, and it was also becoming clear that 2 jabs would not be enough. People's immunity was waning, so richer countries did this.
We are announcing our plan to stay ahead of this virus by being prepared to offer COVID-19 booster shots.
At this stage, boosters were a response to waning immunity, but now they're needed for another reason too, the Omicron variant.
We know that 2 doses of vaccine are not enough to stop you getting infected with Omicron, but a booster will cut your risk of symptomatic infection by around 70%.
That's why in the UK we've seen people queuing for hours to get a booster. This year has shown the need for a 3rd jab. And Omicron has also taught us other ways the pandemic has evolved. For one, just like the scientists said they would, variants have arrived. Alpha, Beta and Delta. It drove COVID infections globally with devastating consequences in India. The threat of variants was real and being explicitly connected to vaccination rates.
We need to be able to find the funds and the means to vaccinate widely across the world. If we don't, what will happen is more mutations arising in the virus, and we will have a harder and harder task to fight the virus as it continues to mutate.
Through the year, the richer countries pushed on with their vaccine rollouts. Nearly 70% of the UK population's been double jabbed. Less than half of the global population has been, and in Africa, it's 8%. And the WHO continues to focus on this issue.
Let me be very clear. WHO is not against boosters. We are against inequity. Our main concern is to save lives everywhere.
We started the year with WHO warnings about vaccine inequity. We finish it with the same. And while richer countries push on with their boosters, Omicron has shown that even vaccinating most people in a country may not be enough. This is Austria. It's made vaccines compulsory from February. And here, and in much of Western Europe, healthcare systems are under pressure despite ample vaccine supply. The question is, what to do about that? Well, mandatory vaccines are a live debate, so are COVID restrictions. This week, a significant minority of Boris Johnson's own Tory MPs voted against his proposed new restrictions. One of them was Andrea Leadsom.
COVID will be with us for many years to come, and it's unthinkable that every autumn from now on we will be limiting the quality of life for all citizens just to be on the safe side.
Now, these measures went through Parliament, and polling in the UK and elsewhere suggests public opinion remains behind restrictions. But this issue will be back. And so here we are at the end of 2021, and the statistics tell their own story. The pandemic's killed over 5 million people. More people have died in 2021 from COVID than in 2020. And with Omicron spreading, I thought this clip of the WHO's Michael Ryan perhaps spoke for a lot of us.
But it introduces a level of concern and a level of fear and a sense of more exhaustion that we all feel. Well, here we go again.
Here we go again, says Michael Ryan. And he also offered some advice.
Just because we have a new variant doesn't mean the situation is going to get worse. It means we have more uncertainty now.
And that is perhaps the best way to summarise the year, because two fundamental questions remain. Can we vaccinate enough people? And how serious are these new variants as we try to do that? At the end of 2021, neither of those questions have definitive answers. And so, as Michael Ryan says, we have more uncertainty now.